Low dose naltrexone has none of those side effects at all, but it helps with pain. And it works with pain in so many different levels. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. On this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgery. Be sure to subscribe for more videos like this one. Okay, let's jump in. Let me start with talking about what is naltrexone. So naltrexone was first developed to help people get off of their opiates, either heroin addiction or just other opiates like morphine. So it was working very effective on that because what it does is it acts on the opiate receptor. So that is at a dose of 50 milligrams to 100 milligrams per dose. And it works well and it's great. But then researchers started studying it for other conditions and started seeing, hey, what happens if we actually do a microdose, a really low dose of naltrexone? What does that do on the body? And they were extremely surprised on all the therapeutic effects they were able to see that was working completely differently than what I call the high dose of naltrexone, which helps people get off of heroin because it blocks that receptor and makes people not get the effects that they want from heroin. But when you do a low dose, it does completely different things. Does low dose naltrexone of like 1.5 to 4.5 milligrams block those opiate receptors? It does mildly. And that's one reason why I tell my patients, if you are on morphine or some opiate medication, you can't be on low dose naltrexone because it's going to make it not work. But when we do those low levels, it doesn't just act on that receptor, and it's not really strong like 50 to 100 milligrams. So people on heroin are still going to get a little bit of high when you're doing low dose, but you're not going to really get the effect that you want. But when we do low dose, you're getting a completely different effects than if you do high dose. Like high dose isn't going to have any therapeutic effect except block the opioid receptor. But when we do low dose, it does so many awesome things. What low dose naltrexone does. Let's talk about what low dose naltrexone does. So what's so great about it? Why is it getting so much hype behind it? So let's talk about how it helps with patients dealing with chronic pain. Okay, we know that morphine helps people with chronic pain, but it comes with all kinds of side effects, right? And you get addicted to it and you get constipated and you can get kind of delirious and lightheaded and you don't really function well and you're not really quite there. Those are the side effects of morphine, but low dose naltrexone has none of those side effects at all, but it helps with pain. And it works with pain in so many different levels. What it does is it works on a toll-like receptor on your microglial cells. So microglial cells are found in high amounts in your nervous system, like your central nervous system and your peripheral nervous system. So patients with fibromyalgia, for example, they have a lot of pain throughout their entire body. And low-dose naltrexone works really well because it works on those microglial cells and decreases how many of those are happening. So we don't really talk about fibromyalgia being an inflammatory disorder per se in the traditional sense of the word, but it does have a modulatory effect on our immune system, like the microglial cells. And through that modulatory effects that it has on the microglial cells, it decreases pain. Because what microglial cells does is it produces inflammatory cytokines and something called substance P and nitric oxide production. These are all things that can cause pain in the nerve. So we could use low dose naltrexone to actually have a direct effect on these microglial cells. And it's one of the few therapies that are actually able to do this without really no side effects at all because it's a really low dose. And even in newer research that we're seeing, I was looking at older research at 4.5 milligrams, we're seeing good effects with, even seeing better effects with treating chronic pain, even going way lower than that, going to like 0.5 milligrams of low dose naltrexone and like maybe even going to 0.1 milligrams and tapering up. There's a researcher that has been doing a ton of research on this chronic pain and really figuring out how to do it appropriately to help with these patients dealing with chronic regional pain syndrome. Is so hard to treat. Morphine doesn't kick it. Gabapentin doesn't kick it. Most drugs don't do anything for chronic regional pain syndrome, but we have seen low dose naltrexone actually work well for this condition because it helps decrease substance P, inflammatory cytokines right at that nerve ending. So it's a really awesome therapy for doing that. Also, it's really great at modulating systemic inflammation throughout the entire body. It does this through modulating T regulatory cells. T regulatory cells are our cells that regulate the immune system. It says, okay, when you get an infection, let's make more of you immune cells to be able to kill off this infection. But it also regulates and says, hey, this is getting out of control. Let's decrease it. And a lot of patients with autoimmune conditions don't have good function of their T regulatory cells. They're making too much immune system in response to infections, and the immune system's getting revved up all the time and attacking certain proteins throughout their body and leading to degeneration of the cartilage or the myelin sheaths or whatever autoimmune disease you have and the damage that it causes. But low dose naltrexone works on that T regulatory cell and modulates it, so it helps your body be able to regulate immune responses better. So it doesn't work like a steroid, which blocks your entire inflammatory response. It actually works on those regulatory cells. So you're able to actually increase your immune system to kill off an infection when you get it, but also decrease it when you have overproduction like an autoimmune condition. So that's what's one of the really cool things that happens with a low dose naltrexone with the autoimmune disease. Let's talk about some other things that low dose naltrexone helps with, and one of them is autism. So this is really cool therapy, newer research that we're getting out there that we could actually use low dose naltrexone to actually help patients with autism. So how does it do that? So what it does is, one thing, we talked about how it decreases inflammation throughout the entire body, and that does help decrease inflammation in the brain. But also what we're seeing in further research in autism is a hyperopioidogenic disease, meaning makes way too much opioids, or there's a dysregulation of the opioids. So let's go back a little bit. Your body does make natural opioids and endorphins, right? Endorphins are like opioids. When you exercise, you get a ton of endorphins, and that's why when you exercise, you can like have no pain. And then you stop working out and it's like, whoa, my ankle really got messed up when I actually hit that rock. Because you're not feeling that pain when you're exercising. But in autism patients, they have a dysregulation of that system. So it can regulate that opioid system inside the body and also help that inflammatory response that is happening in the brain. So we have seen improvement low dose naltrexone on patients. Like I say, with all things, it's not one therapy is going to help a certain medical condition. It's a tool. And low dose naltrexone is a tool for treating autism, but there's all kinds of other things that we need to do to treat this condition too. A big thing I wanted to talk about with low dose naltrexone is how it helps patients with cancer. It's a powerful treatment. It's a major tool that I use. A lot of my patients that have cancer are using low dose naltrexone because what it does on the body. So let's first talk about a big thing it does. The more we can produce of these cells, the greater immunological effect we're going to have on killing cancer cells. And a big piece of cancer and why people get cancer in the first place is the immune system isn't working correctly. So patients without cancer might have an immune system, like their white blood cells are produced well. They might have a level of like 5 to 9, which is a good level of white blood cells, but their immune system isn't working appropriately. And what that is, they don't have enough of certain T lymphocytes like CD8 plus cells to be able to, or natural killer cells, to be able to go after and kill the cancer cells. So low dose naltrexone helps improve that CD8 cell production. Also, people with autoimmune cancer have a inflammatory dysregulation. Their immune system is dysregulated. They have a chronic inflammatory response that's happening throughout their body too. So if we're able to regulate the immune system with these Treg cells that low dose naltrexone acts on, we're able to decrease that dysregulation and make the immune system work better that way. Also, what we're seeing is cancer cells like to grow out in an inflammatory milieu. So low dose naltrexone decreases the inflammation around the cancer cell and decreases its ability to grow out to other tissue. So we're able to decrease its metastasis out and decrease its growth through that mechanism. Another mechanism that we're seeing in the research with low dose naltrexone is it actually manipulation on the cancer cell and causes it to die that way, but it also decreases, it has an anti-angiogenic effect, which is it prevents the cancer cell from making capillaries out and getting nutrients and from surrounding tissue to be able to live. So it kills off those little capillaries and blood vessels that go out and starves the cancer cell through that mechanism of action. So low-dose naltrexone is doing so many things on killing the cancer cell So I prescribe this for a majority of my cancer patients because it really has very little to no side effects to it, and it's a powerful therapy. If you want to learn more about treatments for autoimmune disease and cancer, click my videos to the right. I'm Dr. Jake, and I'll see you there.